Hello, today's Friday, February 11th, 2022. This is Dr. Rhonda Johnson, and today's message is about dealing with pandemic fatigue. Well, first of all, pandemic fatigue is defined by mental health experts as societal distress. Now, let's get real for a minute how this is showing up, at least in the United States. It can show up as grief from lost loved ones, weariness from wearing masks, physical distancing, change in routine, restrictions, mandates, division around the COVID vaccines. Now, I'm sure I'm omitting other ways that pandemic fatigue is showing up in our society. Now, a question I'm often asked is, will life ever return to pre-pandemic normal? And folks, I say probably not, because 89% of the world's top scientists and virologists say that this virus is here to stay. Remember, we have billions of unvaccinated people in this world. We have multiple animal reservoirs for this virus. We have constantly emerging new variants, and our immunity is variable post-natural infection as well as vaccination. One of the doctors that I follow on social media put it like this: we've added a new disease to our population, which is more infectious and more severe than the flu. The world pre-2020 no longer exists. We may want it to, but it just doesn't. Now, the American Medical Association has some tips for coping with pandemic fatigue, and I'll list them. They are recognized signs of COVID fatigue. Your signs may be different than someone else's. 2, seek mental health care if you need it. And folks, don't forget you can call 1-800-273-TALK or 8255 for help here in the United States, 24/7, toll free. Other things that you can do are find ways to have community, maintain hope, create a schedule or routine, focus on what you can control, set boundaries for social media, and continue to practice preventive health measures. Now, that's from the nation's top doctors, the American Medical Association, but I have a few more. Accepting that things have changed and adapt and move forward. One thing we can change, folks, immediately is to get outside. We can do so much more outdoors. Outdoor activities are safer than indoors. And another thing we can do is adjust our indoor ventilation. Open up those windows, get some circulation, and accept wearing masks, especially if you're high risk or live with other high risk people. You probably have a lot of coping mechanisms of your own, suggestions and thoughts. You've made it this far. I hope you'll continue to be safe. Know that I am so glad to be here with you. And as always, my views are my own. Take care.